Just bring it up. Oh. I'm sorry. Okay. So is it started? Yes. Okay. Hi, I'm Dr. Liz Perkins, and I am here at the 8th annual Heart and Hope Conference. I have an audience here, and I believe I'm streaming live by satellite, which is good because it's not very good weather here today. And I'm from the Florida Center for Inclusive Communities, and I'm going to talk today about aspects of health, and I'm going to talk a little bit about some resources that might be useful, and I have some sources that I've developed that are also freely available. And what I want to say to anybody that's watching this, I have this presentation. You can have it as a PDF if you want to email me at eperkins@usf.edu. And the reason why I say that is I've got a lot of things that have direct web links. And so if you have the PDF, you can have access to all those free items on the web. Okay? Okay, wonderful. The website is fndusa.org. to download download this particular presentation. And my website, there's various different websites, but it is www.flcic.org. Okay. So, little rundown on what we're going to do today. What is good health? What are people with disabilities at risk? Why are they at risk for poorer health? Some key concepts to promote self-determination and self-advocacy in health. What resources can help us, and also how can we promote good relationships with our healthcare provider. Some of the research shows that that's really a crucial thing, particularly with people with disabilities, is to get good relationships going with healthcare providers. And part of that is knowing exactly what type of information to tell them, and have some really good information from previous years, so they can help find out exactly how to help and establish good health relationships, and also going forward across, when you work with people for a long time. So what is good health? Well, World Health Organization states that health is actually a complete state of complete physical, mental, and social well-being. So it's not just the absence of disease or infirmity. It is the fact of we have, think about a whole wellness. I've got some more folks coming in. I was just bringing something to them. Okay. So health and state of complete physical, mental, and social well-being. So it's all those aspects. Not just physical, not just mental, not just social, it's all of those things combined together. And some of the things that we produced at FCIC is some different fact sheets, and again, you can email me for those. Why is healthy being important? Well, I'm very biased because I think health is so important because it underscores every other type of activity in life. If you're not healthy, then it makes it more difficult to have a job, hold down a job, it makes it more difficult to learn, it makes it more difficult to do all the things in life that we want to enjoy. So we want to promote the best we can in terms of having a good quality of life. And also, if you have a good quality of life, you'll increase your chances of getting, not getting diseases and illnesses, such as cancer and diabetes and some of these things as we get older. So the healthier you are in the younger years, you set up for a better aging. And so it's really important to have really good health habits. And it's not too late to change health habits. And that's one thing that we do know so. And again, these are some things that we have, just general guidelines for that. So what should we know about putting things into your body? It's a physical aspect, obviously. So what we need to be healthy is obviously good nutrition. And we know a lot about good nutrition and what we should be doing in terms of having lots of fruit, vegetables, nuts, meat, fish, and some dairy. In some cases, some people can't tolerate dairy as well as other people. But it's important to have all different sources of proteins. Also, avoid eating too much fatty food, fried chicken, French fries, although they are delicious, they're not good for one's health, and sugary food. Also, very important to drink lots and lots of water, and especially if you have a lot of medications that you're taking. It's very, very important to keep well hydrated. And if you like soda, that's okay too. Just try and avoid the ones that have a lot of sugar. Okay. We know as our diet, as a rule, we have way too much sugary stuff. I'm not smoking, and again, that's really important. Not only that, but also, even if people around you smoke, that can put you at risk. And so, make sure you be in environments where you don't have access to smoke and have a clean, healthy environment. And another thing, too much salt and sugar to your food. We have a lot of food. We have a lot of foods that are processed, and they add a lot of salt. They add a lot of sugar, and again, that's very bad for our general health. It make us have much higher blood pressure, which is not good. And so we need to sort of make sure that we watch what we have with our salt and sugar intake. Plenty of exercise, walking. Walking is, as all the research tells us, if you don't like to do anything, just walking and standing around much is as good as exercise. That's really what the body wants to do, what our body physiologically and our anatomy was made for. So, we now see people sort of like working at standing desks because just, sitting for a long time in chairs is not good for us. And so, again, walking and moving about, very, very important. And swimming, all great ways to keep fit. So we talked a little bit about the physical. What about the mental aspects of good health? One of the things we know, particularly with some folks with disabilities, is that they might have more of a risk of having anxiety and depression. And so it's all important to know that, we all get anxious about things from time to time, but if it becomes something that it's making your life miserable, that you're very anxious about things all the time, and it's an ongoing process, and you're worrying and you're feeling down, then those are medical conditions, and like a physical condition, they need to have some treatment for you to get better. And there's no shame in that. There's no shame. There's a lot of people that have anxiety and depression, and it's important to recognize that. And then also the possibility of abuse, particularly with people with disabilities, is very strong. It's a very real danger. And so we need to be aware that, there's no reason why we need to do things that make us feel very uncomfortable, and to make sure, if you're in a position like that, that you tell somebody that, what's happening, and it's not what you want to happen. So make sure the mental health is very, very important. So concerns and worries with friends. And if you feel you can't talk to your family or friends, then, always talk to your doctor, okay? Make sure that, you say that you want to speak to your doctor, and then let them know what might be troubling you in terms of that anxiety and that depression, and some of the things that might be causing that. You also need some great sleep. There's no magic number in how many hours that you sleep that makes, in a lot of people, we say the standard 8 hours is a good point to start from. Some people can cope much better with a little bit less sleep. Some cope a bit better with longer sleep. Actually, one of the things that's recently been found out is that, we all think about the Sunday or the Saturday lie-in, and we think, oh, it's great, into the week, we have a few extra hours. I mean, it's actually not really that good for you, because it throws your body out of whack and it's sort of like it takes a little while to recover. And then there are times when obviously you might be very overtired, and that's good. But generally that Saturday lie-in is not normally a good thing for us. And I'm guilty of that sometimes. So try to sleep in at different times and see how you feel. Very, very important though to have a routine that you stick to. Have fun. Life's really important to enjoy and to have some good times with. And so That is something that we can do in terms of our social well-being, learning how to do new things with other people and having hobbies, being part of different groups, going to different places, even just going to a restaurant and seeing other people and having some good times with people. So make the time to enjoy times with families and friends, and always be ready to make new friends. Again, that's one area we do know with people with disabilities, they tend to have a more smaller social group, and it's really important to try and expand and to have a lot of different interactions with a lot of different people. So people can actually, be very sad and lonely if they don't have many friends. And again, with a lot of folks with disabilities, that tends to be the case, unfortunately. So more friends that you have, less likely you'll be feeling lonely, because you might be doing more activities with these different friends, and also be able to sort of just catch up and hang out with them and things like that. Listen to your doctor. What you should do, make sure that you have a good annual physical checkup every year. And also make sure that you say to your doctor, is there any screening tests that I should be having? He'll have a schedule of what, for your general age, what you should be sort of keeping an eye out for. And then follow the doctor's orders. Okay, some of us are not good at doing that sometimes. But, when you're given a plan and it involves different medicines and it involves different therapies, as far as possible, it's really encouraged that you adhere to that, because that is what is the treatment for that particular condition. So make sure you take them regularly and take the right amount, and take them if it says to take them with food, or if it says to just take them after a meal or between meals or whatever. Always follow that information, because that is when that particular medicine works best. It's not there just to sort of annoy us and think, oh, we've got to think about that. It is the fact that the medicine works best. Some work better when they're with food, some work better just on an empty stomach. So it's really important that you follow that advice and instructions from doctors and from prescriptions. And then ask what vitamins you might need. Sometimes some of us have difficulty having different types of diets and having the right types of vitamins. And so it's important that we have those supplements. It's always better if we can get them in our real food, but otherwise it's better if we have, in the absence of that, to have some supplements. So why are people with disabilities at risk for a poorer health? This is basically an issue that we know with the population. So if you have a population of people with the disability versus a population without disability, you'll see if you ask the question how you report your health, it's called self-reported health. This is people who just, they're asked the question. And it's actually a very good indicator, in absence of getting folks' medications and their blood pressures and their height and their weight. This is actually, if you just ask them to self-report, it's actually a very good alignment with what their physical health would be. So you see that if you don't have a disability, about 60% of the population say that they're okay, have excellent, very good health. If you look at the folks with disability, that's a lot less. And in fact, it's the other way around for most of the people. Most people with disability actually report that they have fair or poor health. And so we know that there's an issue with people with disabilities and how they report their health versus people in the population that don't have disabilities. And not only that, there are people in the general population that we have what's called like secondary conditions, so how many different types of health issues that they might have. And so it's very important to think about not only the fact that when compared to the general population, people with disabilities have more than one, have an additional condition, as well as their disability. So they might have disability and diabetes, for instance. Compared to the general population, they have a lot more. So 87% of people with a disability have some other type of health condition. And then they have an average of 4 versus just over 1 in the general population. So they not only have more health issues, they have a lot more of them on a general count. Okay, John, can you hear me okay there? Wonderful. So common secondary conditions. So remember what I said at the start of the talk, we talked about physical, mental and social. We've got these 3 aspects here. These are some of the common secondary conditions. For physical, we have sleep problems, fatigue, skin problems, infections, bowel and bladder problems. All these tend to be more of an issue with people with disabilities. I say a lot of folks nodding their head there. As I mentioned as well, depression and anxiety. Remember back to that mental health that I mentioned about. And then the social, very important. Again, we see secondary conditions. Some of these things are problematic for people with disabilities in general. Having social isolation, lack of romantic relationships, lack of friendships, lack of community engagement. So that's something that we really need to focus on. The fact that somebody might have, as I mentioned, average 4. So you might have a couple of different physical issues, you might have a social issue there, and you might have a depression or anxiety. So that's a lot that can occur for people with disabilities. And so that does make it all the more reason to really pay attention and to have a real good focus on health overall. And then so much so that the government actually released a white paper, a little report about how people with developmental disabilities and intellectual disabilities in particular are a population that really are at risk for health issues. As we mentioned before, like I said, 4 on average, if not more, different conditions. So live with complex health conditions, have limited access to quality healthcare and health prevention programs. When did you last see public health or announcements that included people with disabilities? It's often a population that we don't have information aimed at. Missed cancer screenings. As people are now living longer with disabilities, now they're at risk for having aging-related disabilities or aging-related health conditions. And cancer, unfortunately, the biggest risk factor for cancer is increasing age. So more and more people are living into ages where the development of adult onset cancers is more of an issue. And the problem with that is that very little of the population are actually having the screenings that they should to the same extent. Have poorly managed chronic conditions. About 40% of all people with intellectual disability, for instance, and about 40% of people with cerebral palsy have epilepsy too. It's a co-occurring condition. And what tends to happen with that is it's a long-term, it's a lifelong condition. And sometimes, there's new medications that might be tried, but people are kept on some of the older medications that can sometimes have very severe side effects. For want of changing or adapting to some of the new medications that have come out. And so we see that a lot more with people in the older adulthood, where they've had a lifetime of being on some very strong neuroleptic and anti-seizure medication that really we'd like to try them not to be on those so many, a cocktail of them sometimes, and because of the fact that they can have such severe side effects. They might be overweight, undetected poor vision. Now this is a huge area. There was a report that was done by Special Olympics in 2005 that really sort of just opened up everybody's eyes about vision, excuse the pun. But what it was they looked at their healthy athletes in their healthy athlete program for Special Olympics and found that many people hadn't had an eye test in 3 or 4 years. Well, just imagine if you hadn't had an eye test in 3 or 4 years and when was the last time you had your prescription changed? And if you were trying to look through a prescription that was no longer right for you, all the sort of cascade effects that might have, might affect the way that you're reading, that give you headaches, all sorts of cascades of effects. And mental health problems, as again, I've mentioned before. So what are the key abilities and concepts about self-determination and self-advocacy in health for people with disabilities? So it really is important, as far as you can, to be able to know and describe what all your health concerns are, you know. And sometimes something crops up, and you know, if we haven't got an appointment at the time, we might not sort of pay too much attention to it, and then when the time comes when you do have a visit with your doctor, you've forgotten about it, and then it might crop up again. Always write a list of anything that arises in terms of your health, because some symptoms are sporadic. Sometimes they only come up every so often, but it's important to know about, to understand about your disability and what conditions that might arise. And so you might have somebody that has cerebral palsy that knows that they might have issues with arthritis. They might develop osteoporosis, might have to really be on the ball in terms of having some passive exercises to increase or maintain their muscle mass. And so things like that. So it's important to know. And know what your options for treatment are. We'll go to a doctor, and, you know, sometimes there might be different ways that a certain condition or a certain health issue can be treated. You have the right and the choice to make that choice as well, and sort of say, okay, that seems, I don't want to go down that road yet. I'm going to sort of have physical therapy. I don't want to have a surgery right away. You have that right to make those choices and know what those options are, and ask about them, and ask if there's different things that could be done to make decisions about your treatment based on the advice. The doctor can only do that. The doctor's only supposed to advise. He's not supposed to say, you must do this. So again, it's all about, you know, again, your choices, but the doctor should tell you exactly what the consequences for all of those different treatments are. And to be able to take medications and follow care plans. And if that's going to be difficult for you for a certain reason, about taking certain medications at different times or late at night or whatever it might be, then tell your doctor that. And then they can adjust when certain medications might be given and make life easier for everybody. But, you know, again, you have to tell your doctor. Sometimes, you know, we think doctors are mind readers, and they're not always mind readers. We need to be able to give them the information. It's important to be aware when you're not feeling well and when different medications are giving you different side effects. Is it after you take a certain pill every day, and if you've had it with a certain drink, that you don't feel as good? Well, some pills you're not supposed to take with grapefruit or orange juice or things like that. And then again, it makes the effect of that particular medication not as good. So that's important, you know, think about, oh, well, that's probably why. Think about things that, you know, these things that we can track that might be prompting you not to feel so good. And continue to seek treatment and have regular checkups. One of the things we know, especially when we're younger, we seem to think we're a little bit invincible, that we, you know, our health's fine and we don't need to go to the docs, and it's something that, you know, might not go for every 2 or 3 years, but it's important. It's important that, you know, if you're still healthy, to at least have a good annual checkup, and not to forget that, you know, everybody has the right to make sure that they're all in tip-top condition, and somebody else thinks they're in tip-top condition. And ask if you don't understand. So if the doctor's telling you something and you're not understanding what they're saying, tell them that. Tell them, say, you know, sometimes we have some doctors that might use some language that's a little difficult for us to understand, use some words that are really, you know, you don't really know what those words mean. That's when you say, can you explain that again to me? That's when you say, I'm not understanding. And be firm about that, because that's what the doctor is supposed to give you the information in a format or using language or using things that you can understand. That is their charge too, okay? So hold them accountable for that. And have a circle of support, family members, family caregivers, very important, who to participate into your healthcare. And doctors and health providers have to get informed consent when you turn 18 for you to carry out a medical procedure, and also have to have your permission to share information about you, okay? When we go into those doctors' offices, and, you know, sometimes we think, oh, there's all these forms, and we, you know, not really paying attention to what they mean. A lot of it is these forms here, and they're asking who you can share information with. And it's sometimes they're very difficult to understand, and it's okay if you have to have family members to have that information and explain that information, and to read those forms and answer the questions. But it's important as well that you know exactly what they all are. And then health advocacy, all about health. It's all about good communication, and this is some of the work that I do. Is sort of thinking about, and a lot of the times we've had research that said that sometimes health providers can be poor communicators. And it's a bit of a two-way street, actually, because sometimes what we wanted to do to improve communication is to give good information to the health provider, and to give them information that's useful to them, but it's also easy for you to fill out and give that information. So that's really what's very important in terms of getting information that's easy for you to give and useful for the healthcare provider. And so one of the things that we find, particularly when people have to go into a hospital for a couple of days, or they're going for a procedure and they're around doctors and nurses that aren't very familiar to them, sometimes there can be an apprehension. And a part of that is because some healthcare professionals, well, there's a lot of healthcare professionals, actually don't have much training of working with people with disabilities. And that, you know, when they've gone through nursing school, they've gone through medical school, and they're out actually in the big wide world and only encountering people with disabilities not so often, and then they're just, sometimes there's a level of discomfort because people with disabilities, as I've said, often have a lot of medically complex conditions. Okay, so you know, it's not just somebody coming in with flu. It's somebody that has a disability that might have multiple types of health conditions that need a lot of attention. And unfortunately, what do we know about a lot of health interactions is that they're short amount of time available, and sometimes it's, you know, with people with disabilities, we need to have extra time for them to be able to tell you, and for you to tell your health provider just exactly what's wrong and what makes it better, what makes it worse. So I came up with a health passport that's really been very, very helpful. And this is, again, something particularly relevant for when you're going into a hospital, but also you can use with your general practitioner as well. And it's free, which is great. And the health passport, it's a 4-page document, and it's first thing that we really want to sort of emphasize is, how does a person with a disability communicate? Okay, so first thing on the first page is, how does this person communicate? Do they understand but they're not verbal? Do they use certain words? If they use a particular sound for verbalizing what they mean is yes, like the eek sound, it might be something like that. All good stuff for the doctors and nurses to know and not have to keep, you know, that they can refer to it right in front of them. How they show pain. Some people with developmental disabilities might have communication difficulties and might not use language at all. And so how do they express that they're in pain? Okay, if they're hitting the side of the face, is it because they've got the toothache? Do they go off into a different place when they're in pain? Do they isolate themselves? How do they show that they're in pain? When somebody's not actually physically able to tell you, how do they show it non-verbally? How do you know that? And most of the time, caregivers are the best people to know how that might be. If you get upset or distressed, some people with disabilities have behavioural reactions to certain environments. And so, you know, you go into a hospital setting, and some people might find the smell of the alcohol rub, the noisiness of the rooms, the hubbub of an emergency room to be very, very overpowering. So how can you help them? If somebody is getting distressed, is there a piece of music that, on their iPhone or something that they like to listen to? Do they like to go off just to be on their own somewhere? Again, advanced knowledge of this is really good. How do I cope with medical procedures? Well, you know, sometimes when we're just going to the docs and, you know, he's looking into our ears and he's looking at our eyes, feeling our glands, seeing if everything's okay. That's not really too much of an issue. But how about if somebody doesn't like having their blood drawn? How about if somebody finds it really, describing to somebody how blood pressure is taken? having temperature taken in their ear. So if you know that the individual with a disability has a certain reaction every time that they have certain things, it's good to give people a bit of a heads up about that. Have they ever had a CAT scan? Well, you know, then again, it's a case of, well, that can be an overwhelming experience for some people. So it's good to know exactly what we can do with that. So again, mobility needs, this is sort of when they're getting washed or dressed, how do they like to be assisted with that? You know, some people might make assumptions to the level of abilities that they want and help and assistance with. Drinking and eating, how people might very well be able to feed themselves. That sometimes people make assumptions because they might have limited limb movement. Know all this information in advance, and you know, save a lot of heartache on both people. We sort of hear some stories of folks where, you know, people have just made assumptions and start feeding and say, whoa. and again, it's just a communication thing. Favorite foods and favorite drinks. There are some people with disabilities that have certain foods, certain textures that they will not eat. And if they're in an environment where, you know, that, especially if they're sick and they're in hospital, and, you know, we want to sort of encourage good eating. Depends if they're, you know, not having any operation on the GI tract or something like that. But after, you know, it's what's important is what are the foods that person would or wouldn't eat. And it's no point in sort of saying, oh, the person's being difficult if they just don't eat that as part of their diet. You know, we are very good at adhering to, you know, low sodium, low sugar. But for people with disabilities, they might have, especially with autism spectrum disorder, have certain foods and aversive foods, you know, from the textures of that they just won't eat. Sensitivities. Some people are very sensitive to the certain sounds, let's say, lights, odors, thunderstorms, good one here in Florida, that upsets them. And so it's good to know that in advance. And then what to do to pass the time, especially if you're in a hospital setting. You know, there are times that, you know, about trying to while away the time, and what does that person like? And you know, so the nurses can be attentive to make sure that, oh, you know, we can make that time a little bit more comfortable for the individual as far as possible. And how to make future or follow-up appointments easier. Sometimes it's just easier to have an individual on the first appointment of the day. People sometimes don't realise the transport issues that somebody who uses a wheelchair might have. They might be waiting for paratransit and have a window of time where they're waiting to be picked up. And then, you know, might have a window of time for them to actually attend the, and this is not unheard of, where somebody has to miss an appointment because the person hasn't been seen in time and the transport back's waiting for them and they have to just miss the appointment. Make people aware of that and say, you know, it's not sort of a being late or being difficult issue. These are the parameters of where I have to be at certain times, and I have to keep to these particular appointments, and to give the office staff and the appointment staff a heads up about that issue. So again, this is something that's been real popular and been downloaded, and again, it's freely available. And you can download English versions or Spanish versions, and actually on the website, you can type in the information before you print it out, and so you can update it, and so that's good information there. How would you describe your pain? For people that aren't able to sort of express very well how they describe their pain, often we use pain scales, and it's good to sort of get folks familiar with pain scales as far as possible. That's a really important thing to get people familiar with at a younger age, and so that they're available all through their life to be able to sort of know what a pain scale is and be able to communicate that. And where the pain location is and how could they describe it if they have limited movement, you know, where they're able to point to a certain area if they're not actually able to touch that area of their own body. So things like these, again, you can get just from downloading from this website. And then here's a really good resource website about transition. From pediatric to adult healthcare, and it's called Florida Hats. And Florida Hats Health transition services, health and transition services, and it's got wonderful resources and information for healthcare practitioners, for families, for training and educational care professionals, about health insurance, all sorts of goodies. And what I wanted to draw your attention to, something that's really something on this website. They have some great videos, links to videos, and also on this website, which is called Healthy Transitions of New York. And again, if you email me at Perkins@usf.edu, I can send you the PDF, and you can have all these live links on the handout to you. But these are great little sort of mini videos, just a couple of minutes each, saying how to schedule appointments, paperwork at the signing desk, drawing blood, just to give people a little overview of what would happen in a doctor's visit. So just be warned that it's a big page with a lot of different videos, and from my experience, it sometimes takes a little while to load, and so to be aware of that. And then apps, fabulous things now, lots more apps, health-related apps. I've got my Fitbit on, counting my little steps. Yeah, I know, like sometimes I can jiggle it and make it put in a few extra steps it shouldn't. That's because with Fitbit, I don't know, it's not particularly Fitbit or any other type of health tracker. Sometimes what you can do now is be in competition with other people, and I have somebody that I'm often in competition with. It's like, oh no, she's not going to beat me today. But that's not the point, is that I'm supposed to just do more steps. But there's an app for that. So a lot of these new fitness trackers are really good about sort of maintaining your sort of desire to keep fit. And again, some of these apps are really good for health communication that you can find. How the different types, again, incorporate what the pain is, what the issues are. Here I've got back pain, stomach pain, sore throat, dizzy, and to be able to, again, have the individual with disability really express for themselves what their health issue is. And here's some fact sheets that actually we got here at the display table for FCIC, again, that are freely available. This is the website that you'll download the complete 5 series, but it's about information that's written for people with disabilities to really understand not just what the health condition is, but what you can do to help prevent it, or what treatment you have when you have those particular things. And you know, we all get to different age where more people are with disabilities, they're getting older, so that more of them are developing cancer, but just because of the fact they're getting older. And then osteoporosis, a lot of conditions, epilepsy, you know, that people might have medications for a long time. Some of those different types of medications actually accelerate bone loss. And so it's important for us to be really aware that people with disabilities that might have epilepsy and other issues, people with cerebral palsy that take muscle relaxants, things like that, that these can sort of make more of an issue in terms of developing or speeding on the onset of osteoporosis. And then, as I also mentioned about anxiety and depression, we have, again, some more free health materials for individuals to read about, and reducing the risk of heart and other diseases. Again, this is sort of a fact sheet that I've just split onto 2 slides here, just because of the fact that it's a lot of text. But again, if you want to email me, it's just a little cheat sheet. It's called Stops Chaos, and it's how to reduce the risk for heart disease and other things. So look after stress, temperance, because it's hard to say don't drink, but it fits with my Stops Chaos. Sorry about that. Oral hygiene, potassium and sodium, that's really good for good health, heart functioning. Some people have to take extra potassium. Sodium, not to have too much sodium because that's bad, or too little. Cholesterol, you know, which we can avoid if we don't have too many fatty foods and things like that. Hypertension, the blood pressure, having lots of activity to try and avoid obesity and to try and avoid smoking. So that's the Stops Chaos for health. And again, we got that in a nice little fact sheet for folks. So last 5 minutes, I'm going to talk about promoting good relationships with our healthcare providers. First of all, best thing you can do is to be prepared. Bring all your medications with you, particularly if you have a lot of different specialists that are prescribing you. Sometimes They do not communicate with each other, and they might be prescribing at cross purposes. They might be prescribing, one might be prescribing one type of medicine, not aware that another doctor has a prescription for you for something that actually interacts. Sometimes that's getting better now with health records and being more, electronic and being able to sort of share that information better. But it's still very, very important to bring all those medications with you and to be able to describe your condition. What makes that particular health issue you've come in? Is there anything that makes it better or worse? Is it more painful on a morning? Is it more painful in the evening? Is it after you've eaten, after you've had a drink? All those things that can really help the doctor to describe, to say, okay, this is what I think this issue might be. And bring a health passport, especially if some of that information is going to remain fairly much the same. It's good to just bring all that, and what I say about the health passport is have one for each person that you go to. It's not going to be, it's a document that you share to empower yourself to give the person, the healthcare provider, that information. Listen and record carefully what the doctors say. And you can ask if you can use a voice recorder. How many times have you go to a place and go, no, what did they say? If you're, especially like me, once you hit your mid-40s and you sort of have the hot flushes and the menopause coming on, it's like, oh, I'm really forgetful. So it's not it's a simple request to ask a doctor, say, hey, do you mind if I just record this so I understand and I remember everything that you say to me? Also to write a note. And again, if there's something or a particular word or a condition that he's saying, well, this is what you have, ask them to write it down. It might be a very lengthy word. That's what they're there for. Get them to write it down. And to make notes or to have someone ask. And again, on our smartphones now, we have good little voice recorders and things like that we can actually use very, very easily. And to communicate any concerns and ask questions. At the end of the day, you know yourself the best. If you're not feeling right and, okay, the doctor said, well, I can't find anything, you keep going back until, say, I know there's something wrong with me, because doctors aren't always 100% correct, and sometimes it needs a couple of additional visits to sort of really figure out what the condition might be. So make sure that, you have a right, share everything that you think's relevant, and even things that you think, well, I don't think that's relevant, but tell them, anything could paint a picture to help the doctor make a good diagnosis of how to treat. And this is for professionals, or, if you feel that you want any nurses or doctors that want to know more about developmental disabilities. Like I say, it's not covered in the curriculum. Here's a free web page that has free webinars, 12 of them, all relating to healthcare for people with developmental disabilities. So it's very, very good to access, and it's free available for anybody to tap into. And again, if you want to suggest to some of your healthcare professionals, say, hey, if you have more of an interest in this. So at the end of the day, promoting good health helps us with all aspects of life. I'm obviously a Brit. I'm here at this Dunedin High School and looking at all these Scottish and Union Jacks and that thing, feeling quite at home. So, we have this thing, keep calm and carry on. I don't know whether you know about that was actually it was going to be a brochure that was distributed if England was ever invaded by Germany in World War II, and that was part of the leaflets. Keep calm and carry on, people. So keep calm and have a good life. I think it's a really good thing to sort of make sure that it's a priority in life. Health should always be a priority. We say, oh, well, I've got to go to work, I've got to do this, I've got to do that. Everything's so much better if health is your priority. So that's my point to quickly, we've got a couple of minutes for any questions. Any questions at all from the audience? Yes?
Are the past support and the resource, are those copyrighted, or can we copy it and give it to families giving?
Oh yes, you can.
The information.
No. They are freely available resources that have been developed by our centre. So we've got copies of them at the exhibit table. You can take the information. Some people take it and adapt it for their needs. This is actually, the health passport has been used by some state agencies. It's been in Texas now, and they're using it part of their Medicaid welcome package, because it's a good, like say, empowering health advocacy document. So yes, feel free to use it as you want to, in terms of being able to have the information and adapt it to your needs. So it's
My next question
Yes.
is, do you have it in multiple languages?
we have it in Spanish only at the moment, so we have it in English and Spanish. And if anybody out there wants to work with me to have any additional languages, please contact me. I'd be happy to do that. Okay, great questions. Any other questions?
No, but I love this.
Wonderful, wonderful.
I'm
Yeah,
going to share it with a lot of different people because
take a lot with you.
this is something we needed years ago.
I know. And actually, you know, part of that came out from a needs assessment with our health work group with the FCIC, the Florida Center for Autism.
I would love for our new kindergartens coming
Yep.
into schools
Mhm.
would be able to get so they understand as they're growing.
Wonderful.
I mean,
Yeah,
even though we're older, but
Right.
it still helps me
absolutely.
remember the different things, even for myself.
Right,
And I'm not disabled.
right.
I think it's great
Yeah.
because
Well, not what some people are now using it, you know, for if they have respite care staff, because it's a good cheap quick
Right.
sheet about, you know, how this person
or
can
you
best
just have
support.
somebody coming in taking care of your child.
Absolutely.
They can go back and look, okay.
Right, exactly.
I love
And then also the other thing that folks have been using it is for great information if they have to go into a special needs shelter. You know, transport workers, you know, people that, you know, and you can adapt sort of the level of information that you can share, obviously, but some of those aspects there.
But I'm keeping it, I'm gonna make a copy of it and I'm.
No, you
gonna-
can, you
I'll give
can
them-
take, you
but
can take
I'm
all
gonna
those.
keep one permanently in his backpack
Perfect.
and that would be going wherever he goes.
Okay,
So
wonderful.
who's ever with him during the day and I'm
Right.
not at school or
Right.
I'm not there, they can go right back to there and go, okay, I remember.
I'm so pleased to hear
I
that.
love this.
Family Network through Family Star is putting together a healthcare toolkit.
Uh-huh.
And
This would be.
I am going to use this in
Uh-huh.
that toolkit and share it with you.
Absolutely, wonderful.
And it started through Dr. Shapiro. It was
Uh-huh.
Dr. Shapiro's
Oh,
dream.
goodness gracious.
Yes.
I remember that name very well.
So we're going to share it with you, and I would love for you to review it.
Excellent, absolutely.
Thank you.
So thanks for all those questions. I think we're at our time, and I just want to remind everybody that if they have any questions, and those that are watching or watching the archived one, just to send me at eperkins@usf.edu. Happy to share the information with you. Thank you.
Can I put my name on it?
Thank you.
So yeah, please feel free to take
Oh,
this. I'm so glad you like it.
I loved it.
This has actually been, so 25,000 have been downloaded or disseminated. It's sort of like gone
I'm going to
viral.
use it in our Great American, we do Great American Teach It. And we talk about how to live everyday life with special needs.
Uh-huh.
And this is something we can
We'll
present
take a big.
to the class and tell them this is one thing we do is we fight family.
Wonderful.
Oh, I love it.